Namaskar, I'm Shubhendu Ghosh. Welcome to Tracking COVID-19. In the next half an hour, we track all the coronavirus outbreak-related updates from India and the world. Led by Prime Minister Modi, parliamentarians in India to take 30% salary cut to support the fight against the pandemic. We will talk about the challenge of fake news in these trying times. Meanwhile, UK Prime Minister Boris Johnson, who was infected with the virus, has been shifted to ICU now. Today is World Health Day. In a glimmer of hope, recent numbers show a decline in number of COVID-19 related deaths in Europe. South Korea, one of the initial epicenters, has also reported fewer than 50 new coronavirus cases for the first time since its peak. Let's begin with the top stories. Union Cabinet clears ordinance to slash salaries of MPs by 30% for a year. MP-led funds of 7,900 crore rupees to be suspended for 2 years. Funds to be used to bolster the war against coronavirus. President, Vice President and governors also volunteer a similar pay cut. Prime Minister Narendra Modi holds a video meet with Council of Ministers, asks them to work on a plan for graded opening of departments where hotspots aren't existing. Prime Minister stresses on ensuring reach of Garib Kalyan Yojana, popularizing Arogya Setu app in rural areas. The number of coronavirus cases in India reaches 4,421, while 325 persons have recovered and have been discharged. 114 deaths reported. Goa Chief Minister Pramod Sawant announces 20% hike in salaries of health workers and doctors dealing with coronavirus disease. Confirmed COVID-19 cases across the globe crosses 13 lakh mark with over 74,000 fatalities. Japan likely to announce coronavirus emergency and launch a $1 trillion stimulus package. UK Prime Minister Boris Johnson in ICU as his symptoms worsen. WHO says lockdowns are proving effective in many places, says lifting of restrictions require database calibrated approach. New COVID-19 deaths register a fall in number in Spain. A number of new cases fall in Italy as well. South Korea reports less than 50 new cases. Now let's first take stock of the developments in India in Ground Zero. Among the major cabinet decisions announced on Monday, a 30% reduction in parliamentarian salaries for 1 year has been announced. An ordinance amending salary, allowances and pension of MPs Act has been approved. President, Vice President and governors have decided to take a pay cut as a social responsibility. All the money and funds saved is being redirected towards fighting COVID-19 and will go to Consolidated Fund of India. Another important decision taken is that MP-led funds will remain temporarily suspended for a period of 2 years. Meanwhile, Prime Minister Narendra Modi held a meeting with his Council of Ministers through video conferencing, where he asked them to take substantive steps during and in the aftermath of the coronavirus pandemic induced lockdown. PM has asked all ministers to come up with a graded plan to slowly open departments in areas that have not emerged as hotspots for COVID-19 pandemic. Prime Minister further urged ministers concerned to continuously monitor and ensure that Garib Kalyan Yojana benefits keep reaching the intended beneficiaries in a seamless manner. He also asked the ministers to popularize Arogya Setu app in rural areas and grassroots institutions to further spread information and an awareness about the pandemic. And thinking ahead, Prime Minister urged the ministers to think beyond the lockdown. And he said that action points for ministers during lockdown is that it is essential to strategize for the emergent conditions, essential to strategize and plan for it, prepare a list of 10 major decisions and 10 priority areas of focus once the lockdown ends. Prime Minister also said identify and implement pending reforms in the ministry departments to also maintain objective index on how their work will promote Make in India. The country, PM said, also needs to lessen its dependence on other nations, and this also, once the lockdown is over, prepare business continuity plan to mitigate the impact of the outbreak that was there on the economy at large. Also, PM talked about a graded plan to slowly open departments where hotspots aren't existing, and this should be made. Crisis offers opportunity, PM said, for the country to become self-dependent in medical sector. The PM also asked the ministers to submit actionable suggestions on boosting manufacturing and exports, in particular, ensure new sectors and countries that should be added to India's export net going ahead. And PM also said remain in touch with state and district administrations to provide solutions to the emergent problem of this unprecedented situation and come up with district level micro plans, micro solutions. Continuously also monitor and ensure that Garib Kalyan Yojana benefits keep reaching the intended beneficiaries in the society. PM also mentioned about the use of innovative solutions to ensure welfare of farmers at large, use of truck aggregators in a manner in which we know about cab aggregators to connect farmers with mandis. Also popularize the use of Arogya Setu app in rural areas and grassroots institutions. Some of the action points made by Prime Minister that he spoke about to the institutions. And so also Prime Minister Narendra Modi has wished well for all on World Health Day. In a tweet message he said, today on World Health Day, let us not only pray for each other's good health and well-being, but also reaffirm our gratitude towards all those doctors, nurses, medical staff and healthcare workers who are bravely leading the battle against COVID-19 menace. This World Health Day, let us also ensure we follow practices like social distancing that will protect our own lives as well as the lives of others. May this day also inspire us towards focusing on personal fitness through the year that will help improve our overall health. Let's look at the latest data as of now. The active coronavirus cases in the country stands at 3,981. And number of people, 325 people have also been discharged. The death count stands at 114. The total number of cases in India stands at 4,421, of which 319 people suffering from coronavirus have recovered. So far, there have been 111 deaths. 63% deaths have been reported in people aged 60 and above. The total death count, in fact, has risen to 114. And significant percentage has also been related to the Tablighi Jamaat congregation. Meanwhile, the centre on Monday released an additional fund of Rs 3,000 crores to states to fight COVID-19. Spokesperson of Health Ministry Love Agarwal said the government had already released 1,100 crores from National Health Mission funds to the states for procurement of PPE, personal protective equipment and food items. Now, so far, Meghalaya has not detected any coronavirus cases, but still, as a precaution, the state is taking all measures, including asking people to wear masks in public, shops other than selling essential items remain closed. The sudden upsurge of persons infected with coronavirus in Assam has caused a worry among the people of Meghalaya. Our correspondent Gautam Kumar filed this report from Ground Zero.
Another day of lockdown in Meghalaya and another day of zero infections. With Tripura reporting a case yesterday night, Meghalaya remains one of the only 3 states that have been free of COVID-19 infections. Yet, at the same time, the state government is taking no chances. The latest advisory from the state government requests that all people wear masks when in public. While this led to some resentment and confusion initially as masks were not available, the government has moved quickly and ensured that by 10th of April, at least a 3 lakh supply of masks would be made available. This would be through a combination of procurement from outside the state as well as production from within the state through SHGs and NGOs. With the end of the 21-day lockdown period approaching, the state cabinet yesterday sat down and had a slew of decisions, primary of which is that it will allow private transportation from the 15th of April, which includes inter-district transportation. transportation to inside the state and outside the state, however, will remain shut. Markets will also start functioning on a weekly basis. The government has also appealed to all Meghalayan who are currently residing outside the state to stay put at least till the end of the month. An additional measure that the government of Meghalaya has introduced is to compensate daily wage earners at a rate of 700 rupees per worker per week. Thus, the government is instituting a lot of measures to ensure that life slowly but steadily gets back to normal. But as with all recent government instructions, the instructions ended with the government asking people to maintain social distance, to remain indoors, and to not be complacent. Reporting for DD News from Meghalaya, this is Gautam S. Kumar.
Now, in such critical times, it is important that we stay away from any fake news circulating on internet or social media. In order to stop the spread of fake news, Ministry of Home Affairs has urged people not to use or share information from unverified sources and use information from only verified sources. For any government policies or schemes, they should refer to PIB Twitter. It said that spreading of fake news is punishable by law. Therefore, people, when they come across any fake news on social media platforms, they should report it to www.cybercrime.gov.in. But that's the organization responsible for tackling the challenge of fake news. The nation has been responding positively to Prime Minister's call to donate to PM CARES Fund to help tide over COVID-19 crisis. However, some anti-social elements have been trying to misappropriate the forum by creating fake UPI IDs trying to dupe people. It has been informed that the only correct UPI ID for donating to PM CARES Fund is pmcares@SBI. That's the only one. All the other similar looking, the ones we are showing you on the screen, those IDs are fake, and the people are advised to beware of such fake UPI IDs. Further, rubbishing the reports being circulated on WhatsApp claiming that police can take action against the group admins if jokes are posted on coronavirus, Press Information Bureau in its Twitter account has informed that there has been no such advisory or order issued by the government. Just another fake news that we're busting. Also, there's news doing round that Indian Embassy in Brazil is collecting information of Indians stuck in Brazil. PIB has stated that these are absolutely false claims. So make sure you don't fall victim to any of these claims. We now look at some updates that inspire hope and positivity in tackling coronavirus outbreak in good news. Now, thousands of food packets are being prepared and served to needy people every day by the district administration in Coimbatore. Many social activists are also engaged in serving food to the needy. All the volunteers have been instructed to wear face masks and gloves along with frequent usage of hand sanitizers while distributing as well as cooking the food in the kitchen.
We have been established community kitchen in Coimbatore Taluk office to provide food for the needy peoples who are affected by the curfew imposed by the government. Normally, daily we are planning to distribute around 1,000 food packets to the needy peoples. Yesterday only we have started the community kitchen. From yesterday up to 16th April, we are planning to run the community kitchen with the support of our Coimbatore Taluk staff and volunteers from different walks of life.
Everyone's doing their bit. In Agartala, a tailoring skill development center has turned into a masks production unit to overcome the shortage for medical staff, including doctors, nurses, caregivers, caretakers. It's important to follow the safety norms of wearing masks, gloves and sanitizers. It is also important for patients and family members attending to patients and those visiting hospitals that they must remember to wear masks. This institution playing an important role in that. Inspiring initiative there in Agartala. Let's now scan through the developments from across the globe in World Wrap. We begin with UK. Prime Minister Boris Johnson has been moved to intensive care unit ICU in hospital after his symptoms worsened. Amidst the scare, PM Johnson has asked Foreign Secretary Dominic Raab to deputise where necessary in the fight against coronavirus. Johnson was admitted to hospital on Sunday night and had been undergoing tests after suffering persistent coronavirus symptoms, including high temperature, for more than 10 days. However, he has not been put on ventilator. US President Donald Trump said Americans are all praying for his recovery. And he has good wishes from India as well. Prime Minister Modi has wished speedy recovery for UK PM Boris Johnson in a tweet message. PM said, "Hang in there, Prime Minister Boris Johnson. Hope to see you out of hospital and in perfect health very soon." That's a tweet message by Prime Minister Narendra Modi. In other parts of Europe, even if recent numbers show a decline in the number of deaths, Italy is still one of the worst hit countries affected by new coronavirus, accounting for almost a quarter of worldwide casualties. Some 1,29,000 people have been infected in the country since the outbreak was discovered on February 21st. Around 16,000 people have lost their lives. The second most affected in Europe is Spain, that has reported over 4,000 new cases of coronavirus with over 600 new deaths. The daily total, however, continued to remain on a decline mode. That's a good news. The total number of deaths in Spain from COVID-19 yesterday passed 13,000 mark among more than 1,35,000 cases. On a positive side, a total of 40,000 people have recovered from COVID-19 and have been discharged from hospital. Prime Minister of Spain, Pedro Sanchez, said the weekend lockdown would remain in place until April 26th. Meanwhile, in France, the number of people who died from coronavirus infections increased by 10% in a day to a cumulative total of 6,494 yesterday. However, less new cases are being reported, even though the rate of death has speeded up again after several days of slowing down in France. French people continue to be advised to keep respecting the confinement measures currently in place. And South Korea reported fewer than 50 new coronavirus cases for the first time since its peak by the end of February, as daily infections in Asia's largest outbreak outside of China continued a downward trend. But officials urge even greater vigilance now, saying a large epidemic could re-emerge at any time, with smaller outbreaks in churches, hospitals, nursing homes, as well as infections among travelers continuing to rise. And globally, the death toll from COVID-19 has passed the 74,000 mark, while the number of infections rose above 1.3 million. Moving on, mainland China today reported a drop in the new coronavirus cases after closing its border to virtually all foreigners to curb imported infections, while the central city of Wuhan, epicenter of the outbreak, saw no new death for the first time. China has 32 new confirmed cases of the virus yesterday, down from 39 cases a day earlier. All of the 32 cases involved travelers arriving from overseas, compared with 38 imported cases a day earlier. The overall number of imported infections so far in China stands at 983. Wuhan, capital of central Hubei province, reported only 2 new confirmed cases in the past 14 days. It is due to allow people, the Chinese administration is going to allow people to move from Wuhan city for the first time since it was locked down on January 23rd to curb the spread of the virus. And time now for some expert advice on ways to keep COVID-19 at bay in Dr. Speak. And Dr. Rohit Sareen tells us about the survival of the virus on different surfaces and what all precautions are necessarily taken by us to stay safe.
Survival of the virus will depend upon the surface. If the surface is porous, then the survival is for a shorter time. If the surface is polished, it is for a longer time. Usually they say anywhere from about 8 to 12 hours it can survive on such surfaces. However, there are certain surfaces on which the virus can survive even for 4 days. You see, it has been seen, like on glasses, they have shown that it will survive for a much longer time. On your these plastic bottles, if you see, it will survive for a longer time. So the idea behind this information is that one has to constantly clean these surfaces and be safe, learn to be safe, because we don't really know wherever we are going for our shopping, our daily needs, whether that place is safe or not.
And there are some more guidelines that the Ministry of Health has presented. We leave you with these guidelines. Take good care of yourself. Namaskar.